Welcome to Surgeon Syndicate. If you're paying attention, you know that you only make money when you work. It might be great money, but it's dependent on you. The information on this podcast will help you solve that. We interview experts and provide analysis into financial freedom through commercial real estate. Why? To help physicians like you thrive. Let's dive in.
Welcome to Surgeon Syndicate. This is your host, Dr. Michael McManus, and we are here back with Dr. Joe Pazona, a urologist who is kind of reinventing the model of healthcare and doing it with some success. So, Joe, welcome back.
Thanks, Mike. Had so much fun for the first half. Figured let's keep going.
If anybody missed the first half, it's a great conversation and a lot of it, into the stresses of medicine and the highs and the lows and the feeling stuck and all those things. And it's very much worth listening to. So I encourage you to go back and listen to if you haven't. But now we're going to jump into, so Joe formed a company called Virtue Care and then later Pazona MD Urology. So tell me about this as you left we talked the last time about, how you got fired, a low point, and that kind of pushed you over the edge to doing something new. So tell me about the process then of how you built your next stage of life out of the low point.
So it started with, I think, the right environment. And so I ended up moving to Nashville, which to me helped foster a lot of what I've built. I was in rural markets for the most part, or underserved markets. And there's certainly challenges to delivering healthcare in those markets for a variety of reasons. And, initially I actually joined a private practice, and this was back in 2019. And this was really my first intro to, I guess, the business side of medicine. And I alluded earlier to the story in the last episode about, the partner who told me I couldn't have another day of clinic because my MA needed to fax stuff. Well, that was the practice. And then if we remember in spring of 2020, there was a little global crisis called COVID-19. And so here I am less than like a year into this new practice in a new town. And I'm like, oh God, not again. And, COVID-19 impacted a lot of businesses, including the practice I was a part of. And I literally went to the partners. I said, you guys are in trouble. And they said, what are you talking about? I said, your business model doesn't work. Like, look at just a month of shutting you down with the overhead you have and the revenue you're bringing in. You've been practicing the same type of medicine and healthcare business since 1993. I had a senior partner who's like, Joe, why do you keep trying to find these patients on Google? Like, anyone who finds you on the internet is painful. You don't want them as a patient. I said, okay. So I literally, Mike, did some back of the napkin math. And I said, all right, what are my collections? How much do I have to pay myself next month to support my kids and family and hopefully feed myself a meal? All right, well, whatever's left over is my new overhead. Can I open a practice for this much? And after talking to a lot of people and looking at it, I said, all right, I really don't have a choice. I have to do this because I saw the writing on the wall for this practice, not only for the practice, but just me personally. Their model, unless you were seeing 70 to 80 patients in a day and to me, providing unethical healthcare, you were just not going to be able to even make a living in Nashville. And not proud to say, but the practice did close a year later. But what I did do is at that point open a new practice. Now, leading up to this, I had also, as I was back at the old job and thinking about my situation where here I am, I'm, quote, stuck in this place because of family situation, but there's literally no work for me. The other hospital system was not going to hire me. I'm losing my job. There's literally no work for me unless I try and go do some locums work, which is inconsistent, takes time with getting licenses, and then isn't necessarily going to last long. I said, here we were heading into COVID. I'm like, well, what about telemedicine? A lot of what we do as urologists is simply advice giving, right? I mean, we can counsel patients, Mike, on erectile dysfunction, kidney stone prevention, following up on their prostate cancer, all through just checking some labs and talking, looking at some images. And actually, I got the idea for VirtueCare pre-COVID as I was kind of in this situation. And then obviously as COVID hits, I'm like, okay, well, this telemedicine thing's taking off. And so that's what started the journey. Initially, I looked at VirtueCare as a direct-to-consumer model. I'm just going to learn about SEO, and I'm just going to build a website and write some very captivating blog content, and hired a marketer and said, I'll run some Google ads. This will be a piece of cake. We'll just do cash visits. I'll get a bunch of state licenses. And we actually did a fantastic job building website volume. We build organically to 40,000 website visitors a month, just with me writing silly blog articles. But we'd see maybe, if I was lucky, 10 patients a month. And doing the math, it was just not going to pay any bills. And so I learned a tough lesson that direct-to-consumer branding is not for the faint of heart. And there's a reason places like Roman and Hims make a lot of money, because they put tens of millions of dollars into a marketing and public relations campaign. And so I then said, well, where else can I serve patients remotely? And I went back to that job search, and I said, wait a minute. A couple of years ago, when I went looking for a job, I noticed all these jobs on Practice Link. And then 2 years later, when I started looking again, those same jobs were still there. No one's taking these positions. And I looked at them, and after I kind of got duped by a physician recruiter who's not exactly my favorite archetype of person these days, and I said, no one in their right mind is going to take that job, or they'll just be like me and make a stupid mistake once and then say, forget it, I'm never doing this again. And so that's when the idea came, well, what if we helped build out a virtual urology clinic in these rural communities, given my experience in rural healthcare? And why can't we leverage those docs who were like me? I was on the sideline, stuck in a city where I couldn't work, but yet I was available. So what if we create a job for Joe Pazona? And that's where the concept started. And back in 2021, we got I'd hired a sales guy on commissions, and we started cold emailing a bunch of CEOs, and eventually got a client, and reached out to a fellow urologist on LinkedIn, and the timing was perfect that she was just leaving her full-time practice for a variety of reasons. And she was a mom raising 3 kids and needed work from home. And, VirtueCare launched its sort of hospital partnership plan 3 years ago. And, now we're covering hospitals from Montgomery to Virginia. And I've got 10 plus urologists working with our team. And so, again, I didn't plan for all that to happen. You just don't go, oh, this is our business model. It's interesting how, again, what happened was an idea that we moved forward with. It didn't work. We pivoted. And then when the right time came along, everything seemed to line up. But you got to just get enough at bats out there. And so that was really the entree into that entrepreneurship, was that, again, the necessity of this practice is not working. I've got to figure out a way to make money regardless of where I live, so I never need to move my family again. I think one thing I've learned recently, or a message that I'll from a brand builders group I'm working with, is, you're best served to serve the person you once were. And so a lot of what I'm doing selfishly is for a younger version of myself and for patients I used to serve. And so that's kind of what led to the entree into entrepreneurship, and how VirtueCare and Pazona MD, our practices, started.
I just had a conversation last week at this conference where we were talking about all these things where the hospital has the control. And the discussion was about how would it be possible to build an agency that basically represents the doc, that the docs have control over. It's built to serve the docs, and by better serving the docs, it better serves the patients. And that's kind of what you did, is what it sounds like. And now it's grown into multiple docs, and they're happier. Patients are getting care who didn't before. That's pretty cool.
Yeah, it's funny if you've gotten in my brain here, Mike, because when you said that, one of my ideas, because I think another one of I look at different pain points in my life, right? And where I'm really angry at the system, and obviously the the sort of domination of these markets by certain groups. But the physician recruiter, right? This person whose job is to, I mean, I'm just going to say it, lie about what a job is to try and entice someone naive enough to take the job. I mean, there were flat out lies in the job posting that I took. I mean, it wasn't even subtle. And so, one idea I've had, but I'm resisting for the moment while I'm focused on what I'm doing, is exactly what you said. Like, why can't we form an agency for physicians? We have all the control. I mean, a recruiter doesn't provide any value. They think they should get paid $30,000 because they cold email you all day or send you text messages, and then they pass along your CV to some hospital and then don't provide anything beyond that. Like, come on, I could find any urologist within 10 minutes by going on the AUA website or LinkedIn. Recruiters don't have some magic formula. So, it goes back to, I think, we've got to realize we have all the control. We don't think we do, but we really do, because all of these businesses, if we remember, are built on a patient-physician relationship. That's the core economic model of all of the $4.6 trillion in healthcare. If that relationship ceases to occur, then the entire house of cards comes crumbling down. And as physicians, we need to start empowering ourselves and others to say, hey, wait a minute, you don't have to put up with that. You do have the leverage, you can do this. And, leverage is, I think, another word that we've got to really start doubling down on. And I think that's really one thing that we've done with Virtue Care, is we're leveraging physicians who are right now on the sidelines, whether they want to work from home for whatever reason, or they don't want to take that W-2 job but are willing to travel to do surgeries. We're leveraging that. We're leveraging the fact that it's our brain that is the most valuable asset, followed by our hands. And we shouldn't be wasting our time clicking buttons or sitting in some administrative meeting or driving 4 hours a day in a car or covering 8 different hospitals. Like, we're about to have a major healthcare crisis in this country. I mean, we know the urology statistics. We're going to be short several thousand urologists in the next couple of years. You can say all you want that it's got to be a surgeon in person 24/7. That's the only model that works. That's ideal. You're not going to get any arguments from me. But wake up. If that's your model, then there are going to be millions of patients who are going to suffer because you and I, Mike, are not available to take care of them. We are limited by being one human being in one geographic locale, who's in or out of network with some ridiculous insurance company and contract. And there's a limit because of the system and how complex it is to how many patients you and I can care for. So we better all get really serious about how we leverage the brains of our physicians and utilize it to solve access to the right healthcare. Because one day, otherwise, I don't know who's going to take care of us.
You just said so many good things. I had all these other thoughts. Oh, the one is when you're like, you wanted that whole agency thing, putting it on hold. I think what you're doing right now, though, is already kind of building that, because as you're building out what you're doing and figuring out how it works, and you're bringing in other doctors and other care providers, is almost like the back end of the system to offer the product and make the product work. So I think you're already doing that, and it's not one versus the other. And at some point, when there's more built out, it'll be like, this is how it fits together. So I think you're already doing that work. The other thing I was thinking, as people listen to this and you think about how much we all work in a silo, and we don't have these conversations. And again, this was because I was at this meeting and they talked about how, so there were 300 people at the meeting, I think, ish. And there was a lot of common mindset, because it was people who were looking to do something different, looking to build different revenue streams. But they were talking about how most of these people, when you go home, all the people around you aren't on the same page. Either they're just like, just be a doctor. Why are you doing this other stuff? Or I know somebody who tried that and they failed. And you're still kind of out there on your own. And I think building some sort of network where, you can be with like-minded individuals. To have these conversations will build a lot of momentum. So now there's my thought of, where's this next step? Because at the meeting I found out, and I'm going to give Peter Kim credit again, is they have a mastermind called Momentum MD where they, and again, I'm not selling the program and I make nothing if you join. But what I loved about it is they're putting a group of docs in the same place. So, several times a year they have meetings where they all get together in the same place and face to face, flesh and blood. But then on a regular, like weekly, monthly basis, have Zoom calls like this where you actually spend other time together. But it starts to become a normal thing to do, and to think differently gets normalized. And then it allows people who otherwise might have been stuck to keep moving forward. And I think the more that that happens and doctors start doing things outside of the system is really what will change the system. And it may be that a separate system grows out of it and then eventually tramples the current system. But I don't know. I think that we need a way to get, so you're not on an island and where you can be that what I'm doing is normal. And when you hit those spots, like, how do I do this? If people you can call and everybody puts their head together, and out of that, and that's what led me to decide I was okay leaving practice with my commercial real estate stuff. Is I found a group of people, we meet on a regular basis, put our heads together, solve problems, and like, okay, I have everything I need to quit. Like, I'm not ready. I don't have the money to quit. I can go away. I got a pretty good runway. Um, but it was still really scary. It's still really scary now because my wife and I had a conversation last week about the money and savings account and the rate at which it's going away. And it's a scary thing, but to know you have the people that like, yep, been there. I heard that from so many people who left their, other high paying jobs that were pilots, that were tech people, and like, yep, that's the way it is. Yep. And you're like, oh, okay, it's normal. I feel good that I lie in bed and cry at night that my world might be ending, but that I'm going to get to the other side. So I don't know, maybe I'd love to talk to you more about that. Maybe and have you built a network where you're making these decisions? You have people you talk to or business people, and kind of, how do I go from here? And how did you build that network?
Yeah, again, I think it was not necessarily intentional with how I got to where I was, and was built very organically. So I think first and foremost, mentors come in many different forms. I look at every podcast I've listened to, every business book I've read, all of those people as mentors, and so pivotal pieces of literature, whether it's like, The One Thing by Gary Keller really stands out to me. Just the power of focusing on the one thing and asking, what's the one thing I can do today that, if by doing so, everything else becomes easier. From being inspired as well as receiving tactical advice on the Tim Ferriss podcast. I look at those two guys as mentors, and that's, I think, the beauty of the age we live in, right? There are just moguls and titans who are out there who we all have access to in one manner. Number two, I think being in Nashville has certainly helped. This is a very entrepreneurial city, a lot of healthcare companies, whether it be from the investor side or the healthcare delivery or the tech side, are here. And so I've really been blessed to meet some amazing people. In fact, I met my business partner and he's fine with me sharing this because he's told the story himself. He met me because he came in to see me as a patient, and ultimately, didn't intend, but I always I do a lot of vasectomies. And so I love that I'm here in Nashville doing vasectomies and all these guys from all these walks of life. And so I always ask them, like, hey, what do you do? Tell me, what's your job? What hobbies do you used to have before you were a kid, before you had kids? Like, just sitting there, just hanging out. And he told me about his venture into business and how he exited a company and made more money than he knew what to do with before the age of 40. And I said, hey, could I take you out to a cup of coffee and just pick your brain? And I had a little PowerPoint with no set agenda that I just like, hey, let me just run you through what we're doing. And next thing I know, we formed an MSO together, and he's an investing business partner. And so, again, didn't go into any of this intentionally. Like, well, okay, so first I'm gonna, go read this specific book, and then I'm gonna just go find an angel investor. And you just got to put yourself out there and be curious, and people are willing to help. And so, I think that's the key, is that, go into networking and learning from others in a very humble way. And then once you start getting to a point, figure out a way to serve that other person. I think we can all figure out who's predatory on LinkedIn and who's calling just to kind of use you, and who doesn't value your time. Now, if you're a physician, I'll take a phone call with you, because we're brethren, we're colleagues. I can empathize with what you're doing, and I'm not going to charge you $1, and I'll sit and talk to you for an hour on a Saturday while I'm out thinking and walking. I'll come and do this podcast with you, Mike, because you ask nicely, and you seem like a really good guy. And flattery goes a long way. But, I think there's a lot of people who are willing to help if you just ask for it and look. Because again, these concepts of business are super, super simple. People fail in business because they get complex. People fail because they take on undue risk. But if you really stick to just a handful of principles, it's not a matter of if it'll be successful, it's a matter of when it'll be successful. And it may be attempt number 132, but it will be if you stick at it and you've got that unwavering faith and you put in that work. And the good news is, as surgeons, we're going to put the work in. We've checked that box of, pre 80-hour work week, counting, how many hours of sleep you had outside the hospital on one hand. So we don't have to worry about that part. It's the believing in ourselves. And again, just you got to get curious. And, we got into medicine because we were learners. Like, you could not have gone to medical school if you didn't love learning, because you wouldn't have had good enough grades. You couldn't have absorbed the material, and you couldn't have gotten into med school and then finished a residency. But it's seemingly the day we finish residency is the day we really stop learning. We become arrogant. We think we know everything. I'm done with my training. I'm board certified. Don't tell me what to do. And we just willy-nilly go into things. And that's where we see physicians make bad financial decisions, open restaurants and businesses, and invest in real estate without doing their due diligence and doing what you did, which was, sounds like you surrounded yourself with a group of people who know what they're doing. And so I think if you do it the right way, it's guaranteed to succeed. But you gotta have that humility and curiosity. I think that's the key to that networking and that growth and getting those skill sets.
I'll listen to you. I was thinking about, like, I did a lot of things where and it's a total doctor thing. Like, I need to understand this more. I got to learn more. And I spent a bunch of money and built out a bunch of complex systems that I built out like 2.5 years ago, and I'm just starting to use them. And they've cost me money for 2 years. Instead of, kind of what you said is, okay, I got this thing I think the world needs and that I want to provide, and I'm going to start doing it. And what's the next step I can take? And how can I take that step with as little money as possible?
Mm-hmm.
And then you can kind of bootstrap it yourself. But then when you hit those points where you're like, okay, I see the path, but I need more money now, and I need to take this leap, and there's some stuff I don't understand. That's such a point where what you did is then you're finding people, and there's a lot of really experienced, brilliant business people out there who want to be involved in medical entrepreneurship.
Mm-hmm.
And you kind of put yourself out there and have some conversations with people. And it seems like it probably wouldn't take that long to find somebody who, after a few discussions goes, well, I like this idea. Here's how you need to change it in my, business experience of having launched multiple, 8-figure businesses type of people.
Yeah.
And they look at the amount of money that looks like, when you look at it coming out of pocket, you're like, oh man, can I spend that? And to them, it's not that big of a check, and they love the project. And you get out of it, you get to keep moving. They teach you things that all of a sudden you not only just brought an investor, you brought a mentor, you brought a coach, and they can start telling you, no, don't do that. do this. You do this right now and nothing else. And then you start doing stuff that most, that moves the rock. And those are such awesome people to have, and they're out there. They want to help.
Yeah, and I think people are listening, like, but how do I do that? Like, you just have to put yourself out there. Like, there was no, I didn't go into this going, all right, well, I'm going to do 3,000 vasectomies over these next 4 years, and I'm going to talk to every guy I do a vasectomy on and find out what he does. And my plan is I'm going to find a guy who made a lot of money from an exit, and we're going to become friends, and then he's going to invest in me, and problem solved. There's my mentor. But yet that's kind of how it happened. Was I just said, I'm in a place, so environment like Nashville, where there's a lot of entrepreneurial people. I'm going to focus on vasectomies because it was a primary business model. I knew I could go direct to consumer with marketing and build some steady revenue. Let's get some early wins. Let's get a foundation that I could sit and attract guys who were similar to me from different walks of life, and then serve them great and walk them through a scary experience. And we're just having a conversation. I didn't go into that thinking I'm going to find a business partner. I went into it going, this is my best path toward financial freedom in the short term, and I'm going to really serve these patients better than anybody else. But then that led to him introducing me to his old COO, who came and worked with us and helped relaunch our marketing and get our operations going during a critical time. A guy who's brilliant with operations, something I really have struggled with. Who then made introductions to a great finance person. So it's amazing how you just put yourself out there and all these little things start occurring. But the key is action. I think that is a big struggle point for physicians, right? I've talked to tons of physicians who've reached out on LinkedIn or just colleagues calling me up. And there's plenty of us who are burnout, and there's plenty of us who have great ideas. Very few are going to take action. Very few are going to take action. So I think that's my call to action to whoever's listening is stop talking about it, just do it. I was listening to one interview, I think on the Tim Ferriss show, with a guy, I think it was Noah Kahan, and he's got a principle called now, not how. Stop trying to think about how you're going to do something and just do something. Just do it. It's not the decision that you have to worry about. It's the lack of a decision that is the trouble. Just make the decision and go with it. And either it's going to work or you're going to learn. Either way, you win. It's interesting, as you think about, like, we're surgeons, right? We want the step-by-step process. Like, how did Joe get from here to here?
Yep.
I didn't plan any of it. I think again, I followed some basic business principles. I started with why. I made sure that my reason for doing this was really freaking strong, such that every day that it was going to be a struggle, I knew what I was doing it for. And that was for my family. It was for a younger version of myself, and it was to serve my patients in a way that I don't feel like they've ever been served before. It was bootstrapping it, like you said. I went into this initially where, again, it was back of the napkin math. I'm like, I have to open an office, and this is my budget. It was kind of like one of those daily fantasy football leagues, right? Like, build the best team with this amount of money, right? And so, you get these docs like, oh, well, I got to take out a home equity line of credit because I got to build a brand new office. And if I build this beautiful place, no, you don't. There's an orthopedic surgeon in Colorado who opened a micro direct practice orthopedic practice. He does house calls. He goes to primary care doctors' offices and sees patients for cash there because he's like, I'm just going to give them unreasonable service. I'm just going to go travel to their office, and I don't have rent, no overhead. He's making it work. In fact, he's thriving, so there are ways to be really resourceful. And so you've got to put aside that ego, and you've got to question everything, and you've got to really look at it. And so I'm glad I didn't have money to do it. In fact, I was joking with my business partner the other day, Mike, we took an investment from him, which allowed me to separate myself from the business, at least my personal side, because it used to be, all right, well, what's left over this month to pay me? Because that's my salary this month. It's whatever's left over. I got to pay everyone else. But that puts a certain pressure on you, and you want to put that on the team because you want to grow, and you got to pay your bills. And so he gave me a runway to pay myself without worrying about it. He gave me some runway to hire people and expand. And, what's funny is we ultimately built a system that is now evolved to a point where it's different than what we started with, or at least our brick and mortar practice. And it was getting away from our roots of simplicity and being really lean and questioning every decision we made, because we had cash, right? Let's just go through it. And I think, anyone who's watched, say, the WeWork story or any other thing out there, you can burn through hundreds of millions of dollars like that. So it's almost a blessing in disguise to have to bootstrap something and get really gritty with it. And so, I think, again, the principles are simple. Everyone out there is like scared about to just act. People like me are out there. I could introduce you to plenty of other successful physician entrepreneurs that are doing this. It is possible. And that fear of leaving, trust me, it's so much freer on the other side. You won't think twice once you're there.
I was just thinking when you were talking about that they started that micro orthopedics practice. You could do that if you're employed. You could do that while you're still employed. You could, cut back to a day less a week and go do that one day a week. Even if it's someplace you drive like 2 hours down the road out in the country, or you find somewhere, you just start looking for somewhere where the door swings open a little bit, and you go start doing that one day a week. You still have an income. It's come down a little bit. You didn't have to jump off the boat.
Mm-hmm.
And as you start doing it, you're going to learn what works and what doesn't work. And you'll, probably look back and maybe you get lucky and hit a home run right off the bat, or you just start making mistakes until you find like, okay, I found something, and keep going. That would be a pretty cool pathway for somebody to make a slower exit. I'd never even heard of somebody doing that before, especially as a specialist, is going to primary care and be like, could I come to your office one day a week and see your patients that need these things?
Mm-hmm.
And especially if there's a few still primary care who are in private practice, they would love that.
Mm-hmm.
Wow, that's cool. All right. Well, Joe, this has been absolutely awesome. I've taken more of your time than you committed to originally, so I thank you for that. Anything else you'd like to share before we wrap up here with our listeners, the key take homes?
No, first off, Mike, thank you. I really appreciate this platform to, share my story. What my journey and what I'm doing is not unique. And I think we need to be more vulnerable as surgeons and as men. I have no problem sharing that I've been fired and went through a divorce, and I've had low points and literally had to peel myself off of a carpet. That's what makes me who I am, and I'm grateful for all of that. And all of you have your stories as well, but ultimately take radical responsibility for your life. We get one shot. That's it. We see it every day. Tragic stories. We don't know how much time we get on this beautiful planet, or how much on this beautiful planet's got left. And so to sit back on a life full of regrets when we have this power to greatly impact thousands of people's lives. We really do. And to think that you're just toiling away, stuck in a system, just another cog in the wheel. Now, not how, just act. You can do this. The other side is not quite as scary as you think. And so my one ask is for folks, if they're interested in staying in touch, follow me on LinkedIn. You can just look up Joseph Pazona and find me. And I'm taking a little hiatus to focus on some business activities, but you can read through some old posts and DM me. And I welcome a conversation with any physician who's considering taking a leap of faith and doesn't know how, or they have and they're struggling and just want someone to listen to their story and go, yep, I made that mistake too. Because I've burned through hundreds of thousands of dollars. I've hired the wrong people. I've had the wrong business models, but I'm still here. And we're just scratching the surface with what we're doing with Virtue Care and Pazona MD. And I'm looking for other physician entrepreneurs to come join our team. We're expanding into other services with our rural hospitals. We've got some big plans for Pazona MD coming up here in Nashville. And so, ultimately, I want to help the older version of myself. I want to serve that person I once was. So please reach out. I'm not trying to get 1 million followers on LinkedIn. I just really want to help people and build that momentum, because I think that my final statement is, we all know we're in a broken system. And I'll second what you said, Mike, earlier, that the path is when enough physician entrepreneurs come together and we build a new system, one that is better, one that is free of predators, one that is focused on that patient-physician relationship and the healthcare team. And once we realize we have that power, and if enough of us get rowing in the same direction, the system will come crumbling down. I truly believe it. It's broken. It's not a matter, again, of if, it's just when. But it's going to take a lot of people, because we got some Fortune 5 companies in healthcare, like the United Healthcare group that's out there, or United Sick Care, as I like to call them, that are just predatory and destroying the system. And so we have the power of physicians. You can do this. And if I can serve any of you, I would really be honored to do so.
Well, thank you for being here. And that's great. And I think even every time you say something, I start thinking of more, but even if we're not all together on the same path, but it's like 1 million ants out there running around, finding little opportunities, but that individually kind of start building a new system and tearing the other one down. It seems like nothing will ever change until it does. And there's a lot of, United Healthcare could be Blockbuster. Wouldn't we love that? One day.
Let's make it happen, Mike. It will happen. I mean, listen, everything comes in phases, right? I mean, we've had, we go back to the good old days of medicine, and it was just a doc hanging up his shingle in a town. Come and see me. We pay cash. I take care of you. And then over the years, it got more complex, and we start consolidating, and then we hand over control and the payments to the insurance companies. And then we get all these other predators in from industry, and gets more complex and bigger, and I don't know how to do this, so I'm going to form a bigger group of doctors. And now we're at this point where, private equity is buying up all these practices, and all these hospital systems are buying up practices. And again, they don't know how to take care of doctors. I'm comfortable saying that. I mean, it's just, that, I know that, our doctors know it. Are there standouts? Absolutely. There's some wonderful healthcare executives out there. There's some wonderful systems out there. But for the most part, I think, especially in the private equity world, how much juice you're going to squeeze from that lemon? How many more ancillary services or productivity can you get? How much more money you think you're going to make in that prostate cancer drug, that ultimately Mark Cuban's going to figure out a way to crash the price on and sell at cost, right? You keep chasing all these shiny balls just to make money. But if instead we physicians serve each other and serve our patients and build teams, we have to be the leaders of those teams, but we can't do it alone. We have to build a team, and we got to get over this arrogance that you can do everything by yourself. You cannot. But if we really want to make a dent, then we've got to come together. But even if you're just that ant building your own cool little separate ant hole, like the guy in Colorado, man, kudos to you. I'm not going to throw shade on anyone who's out there doing it on their own. I'd like to, if I can do it long enough that I don't have any more gray hairs, although they're rapidly increasing even on this call as I'm talking, just from the stress of talking about this, I'd like to try and make a dent. I'd like to get enough of us together and do something really big. And I think we can.
Awesome. Well, you guys reach out to Joe on LinkedIn, because he puts great stuff out there, and it's all quality. Joe, I appreciate you being here. Thank you so much. For everybody listening, this has been valuable to me. I hope it's been as valuable to you. And join us next time here on Surgeon Syndicate.
Do you care about paying too much in taxes?
And would you like to save more of your hard-earned dollars? Here's what we found. We found that most financial professionals have a one-size-fits-all solution. So the question is, would it make it easier for you to have someone tailor your tax solutions to your individual needs so you can keep more of your money and do what you want with it? That is exactly what we do at Excelstra.
As surgeons, we know the difference between routine surgery versus life-threatening interventions. And I want you to know that I've used Unicia and her team for my personal financial intervention, and I love the results. I would do you a disservice if I didn't recommend them to you.
We'd love to help you, so let's jump on a call and see how we can collaborate. Simply go to www.excelstra.com/McManus and book your free call today.
This has been an episode of Surgeon Syndicate. If you got value from this episode, you know other surgeons are hungry to become job optional, and you can help them by sharing this content today. Schedule a call and we can make a plan. Looking forward to having you with me on the next episode.